Good day. Jose R. Reyes Memorial Medical Center, together with the Health Emergency Management Committee and the Infection Prevention and Control Committee, would like to present the modified use of personal protective equipment in managing patients under investigations or PUI patients and confirmed COVID patients. This is our institution's response to the depleting numbers of personal protective equipment and increasing number of COVID patients. For your safety, let's start. Ensure that your hair are neatly fixed to prevent contamination. Use clothes that can be decontaminated later on. Remove your jewelries and perform hand hygiene. After which, change your shoes that can be decontaminated later on. And again, perform hand hygiene. Wear your shoe cover. Put the strap below the garter. Now it's time to use your coveralls or your hazmats. Followed by your fit-tested N95. Put the upper strap in your crown area and the second strap to your nape area. Perform seal check. Now it's time to hood up. After which, wear your goggles. And your face shield. Now it's time to use your first sterile gloves. Wear your sterile gloves in contact with your skin. Then, wear your second gloves. Wear your second sterile gloves and tuck it out in your coveralls. Now, this can be used as your PPE in your COVID hallways or hot area. Now you are ready to manage the patient. Following our contact precaution guidelines, place surgical mask on top of your N95 mask. This is to prevent possible droplet particles or particulates that can contaminate your N95 mask. Wear one set or one pair of clean gloves to be used later on when you open the door. Now, it's time to wear your gown. Remember, dedicated surgical mask and gown must be used on each patient. Secure your gown properly and tie it up. Use another pair of clean gloves to be used for your patient. This is your hot gloves. Hot gloves must overlap the sleeves of your gown. Now, you are ready to open the door. After patient management, your gloves and your gowns are contaminated. So, untie your gown, loosen up, and remove the snap. Remove your gown without touching the inner part of the gown. Roll away from you. In doffing the gown, first layer gloves or hot gloves must be removed. So this is a new set of gloves. This is semi-clean and semi-clean. So we will remove our mask. Remove the mask from the lower thigh and upper thigh. And dispose it properly. After which, you can open the door using your dominant hand. So, you are already outside the door. Remember, a while ago you used this hand to open the door. So, this is considered as contaminated. We will remove it and dispose it properly. Now, you can go to other patient wearing new sets of masks, gloves, and gown. Use your spare gloves later when you open the door for your next patient. Now we are ready to doff. This is semi-clean and semi-clean. Consider your dominant hand as your clean hands to be placed at the back and the other one on the front as your dirty hand. For support, remove your face shield. Now, again, your dominant hand at the back and the other hand to support your dirty surface. Set aside for decontamination. Now, you can remove your warm gloves. Dirty to dirty technique. Remove your gloves away from you to prevent contamination. So you have the last pair of your gloves. This is semi-clean and semi-clean. Use your index finger in tracing your zipper line. Now, unzip your coveralls. Now, you are ready to remove your hood. So use your two hands up and down. Then pull the shoulder without touching your clothing. Lower your waist without touching the inner surface of your coveralls. In removing, avoid contaminating your pants. Roll your coveralls on the floor and dispose it properly. Remove your shoe cover. Use the two-hand technique in removing the strap. Maintain the legs apart. Remove your shoe cover without touching your shoes or your garments. Dispose it properly. And now, you can remove your dirty gloves. Use the dirty technique. And perform hand hygiene. Now you can remove your N95 mask. So remove the strap from the nape area, then on the crown area, and dispose it properly. And again, perform proper hand hygiene. In leaving the anteroom, you will be needing piece of gloves. Wear your gloves in your dominant hand. This will help you protecting your hands from your contaminated shoes. Be sure not to step on the floor of your anteroom. Place your contaminated shoes on your soaking solution for decontamination. Remove your gloves and perform hand hygiene. After which, you can now rest and take your shower. Together,
We will fight this COVID-19 and win this battle. Thank you, and please be safe.